Homeopathic Academy, a new venture by the Bijan Group, is a virtual platform that brings together experts of homeopathy from around the world to teach, guide, and share their clinical experiences with learners and enthusiasts of homeopathy from around the globe. What you get in addition to learning from internationally acclaimed experts is a completion certificate and an opportunity to intern with them. The Homeopathic Academy brings forth myriad courses in all subjects for everyone. For students, we have undergraduate and postgraduate level courses. For those aspiring to crack the competitive exams, THA offers MCQ-based competitive exams preparation courses fortified with visually explained concepts through animations, tables, charts, and graphics. Besides this, all our video lectures are subtitled in British English for easy comprehension. That's not all. We have something for our practitioners too, a variety of CME courses authored by experienced international authors to enhance your medical skills. The Homeopathic Academy has a blazing desire to take homeopathic education to a whole new digital level and attain nothing short of perfection. So learners, what are you waiting for? Get 24/7 unlimited access to theoretical and practical knowledge with opportunities to interact with international authors and assess yourself through quizzes. Also get the opportunity of internship at the Authors Clinic and periodic updation of content with latest advancements in research and syllabi. Log on to www.thehomeopathicacademy.com and keep learning. The Homeopathic Academy, a new venture by the Bijan Group, is a virtual platform that brings together experts of homeopathy from around the world to teach, guide, and share their clinical experiences with learners and enthusiasts of homeopathy from around the globe. What you get in addition to learning from internationally acclaimed experts is a completion certificate and an opportunity to intern with them. The Homeopathic Academy brings forth myriad courses in all subjects for everyone. For students, we have undergraduate and postgraduate level courses. For those aspiring to crack the competitive exams, THA offers MCQ-based competitive exams preparation courses fortified with visually explained concepts through animations, tables, charts, and graphics. Besides this, all our video lectures are subtitled in British English for easy comprehension. That's not all. We have something for our practitioners too, a variety of CME courses authored by experienced international authors to enhance your medical skills. The Homeopathic Academy has a blazing desire to take homeopathic education to a whole new digital level and attain nothing short of perfection. So learners, what are you waiting for? Get 24/7 unlimited access to theoretical and practical knowledge with opportunities to interact with international authors and assess yourself through quizzes. Also get the opportunity of internship at the Authors Clinic and periodic updation of content with latest advancements in research and syllabi. Log on to www.thehomeopathicacademy.com and keep learning.
Hello, everybody. Good evening. I am Dr. Rashi, and I am SME at the Homeopathic Academy. I welcome all of you. We are waiting for other people to join in, and soon we'll be beginning with the webinar.
The Homeopathic Academy, a new venture by the Bijan Group, is a virtual platform that brings together experts of homeopathy from around the world to teach, guide, and share their clinical experiences with learners and enthusiasts of homeopathy from around the globe. What you get in addition to learning from internationally acclaimed experts is a completion certificate and an opportunity to intern with them. The Homeopathic Academy brings forth myriad courses in all subjects for everyone. For students, we have undergraduate and postgraduate level courses. For those aspiring to crack the competitive exams, THA offers MCQ-based competitive exams preparation courses fortified with visually explained concepts through animations, tables, charts, and graphics. Besides this, all our video lectures are subtitled in British English for easy comprehension. That's not all. We have something for our practitioners too. A variety of CME courses authored by experienced international authors to enhance your medical skills. The Homeopathic Academy has a blazing desire to take homeopathic education to a whole new digital level and attain nothing short of perfection. So learners, what are you waiting for? Get 24/7 unlimited access to theoretical and practical knowledge with opportunities to interact with international authors and assess yourself through quizzes. Also get the opportunity of internship at the Authors Clinic and periodic updation of content with latest advancements in research and syllabi. Log on to www.thehomeopathicacademy.com and keep learning. The Homeopathic Academy, a new venture by the Bijan Group, is a virtual platform that brings together experts of homeopathy from around the world to teach, guide, and share their clinical experiences with learners and enthusiasts of homeopathy from around the globe. What you get in addition to learning from internationally acclaimed experts is a completion certificate and an opportunity to intern with them. The Homeopathic Academy brings forth myriad courses in all subjects for everyone. For students, we have undergraduate and postgraduate level courses. For those aspiring to crack the competitive
Okay. Hello, everybody. So once again, I am Dr. Rashi and I am SME at the Homeopathic Academy. Today we've gathered here to talk about World Childhood Cancer. And today is 15th of February and we'll be talking about the treatment effects of childhood cancer, the late effects, of course. But first, let me acquaint you with the Homeopathic Academy. So the Homeopathic Academy is a venture by the Bijan Group, and the Bijan Group does not need an introduction to the homeopathic world. Now, the Homeopathic Academy is relatively new and was launched in 2019. And in a very short span, we have accomplished our goal. We have been able to provide all of you with a number of courses at the undergraduate level, at the postgraduate level, and at CME level. We also have courses running live now for competitive exam preparation. These are all premium quality audio video lectures, and they are subtitled in British English. All these courses, you can see them on your screens right now. You can log on to www.thehomeopathicacademy.com and enroll into any of these courses. The utility of these courses is to enhance your skills in homeopathy. And they also give you practice lessons and practice MCQs, practice quizzes to check your knowledge. So on your screens, you have a number of these courses that we have live right now on www.thehomeopathicacademy.com. Okay, let us come to today's webinar. So today is 15th of February, again, World Childhood Cancer Day. This has been designated as World Childhood Cancer Day by the WHO. The webinar series that we have just started is called Getting Started with Pediatrics. So we'll be talking a lot about pediatrics in this webinar series, but the topic for today that we've chosen is utilizing homeopathy in post-treatment effects of pediatric cancer in cancer survivors. Now, the reason why I thought cancer survivors are a good group of study for today's webinar is because most of the times the patients that you get in your practice are not the cancer patients. Nobody after cancer thinks that we can go to homeopathy primarily. They go to an oncologist. So the primary patients that you get in your clinics are cancer survivors. Now, before I talk about cancer survivors and the effects of treatment and the management of the cancer survivors, I'll like to present before you this little news piece. This news piece says homeopathy doctor held liable for gross negligence in treating carcinoma patients. He was told to pay compensation, and the compensation, if you can see on your screens, was 50,000 rupees. And when I talked to my lawyer, she said this compensation can go up to 20 lakhs. So I thought, is homeopathic management of cancer survivors really just about therapeutics? When we talk about management, we talk about therapeutics, we talk about homeopathic medicines. But is management just about therapeutics? The answer is clearly no. We are a holistic system, and we need to treat patients holistically. So today, we'll be talking about the very basic negligence that we commit on our part when we are dealing with the cancer survivors. So we'll be talking about the effects of chemotherapy, the effects of radiotherapy, the effects of steroids, the effects of the nutritional deficits that we see in these patients, and the behavioral aspect of these patients. Okay. It is first it is important to know what the problem actually is. When we're talking about dealing with cancer survivors, we must also know what exactly is the problem. Why is cancer, especially in children, so deadly, so dreadful? So the WHO, it says that every year around 4 lakh children and adolescents, that is, this group is between 0 and 19 years of age, before 20 years, they develop cancer. And the problem with childhood cancer is that unlike adults, you really cannot attribute the cause to lifestyle problems, to environmental problems, and a lot many factors that we see in adults are not seen in children. So this is the reason why nobody has yet been able to pinpoint the cause of childhood cancer. Now, currently on your screens, you can see the cancer incidence, the childhood cancer incidence. So majority of the patients are leukemia patients. This is followed by CNS tumors, then lymphomas and soft tissue sarcomas. Thereafter, you get neuroblastomas and renal tumors. And then finally, 16% of them are fall into the others category, where you can get retinoblastoma, you can get other tumors also. Again, the problem here is that this is a genetic change, and then that develops into a tumor, but we do not know what excites cancer in children. So we do really have some risk factors. We do have chronic infections like HIV, we have Epstein-Barr virus, we have recurrent malaria, repeated malarial infections in children. We have hepatitis B and papilloma virus, which eventually can lead to childhood cancer. Now, all these risk factors we've covered in the course Pediatrics. This pediatrics course is again live on the homeopathic-academy.com. We can you can enroll into the course by logging on to www.thehomeopathic-academy.com. Now, if you look at the right side of your screens, we have the offer running for all the webinar attendees here. You can check the offer. We are going live with the offer, and it will stay valid for the next 24 hours. So you get 20% off on this course by using the code TS20. You can log on to www.thehomeopathic-academy.com and utilize this coupon code to get your discounts. We've covered all this in this course called Pediatrics. Okay, coming back to childhood cancer, we'll talk about the strategies that WHO has given us to improve the outcomes of childhood cancer. So obviously, it's a prompt diagnosis followed by a good treatment and a good support system. And obviously, homeopaths fall in the support system category. Of course, I do not say that we cannot treat cancer. We, of course, can treat cancer. But then in cancer survivors, we definitely fall in the support category. The treatment plan, let's take an overview first of what childhood cancer is. So the treatment plan for childhood cancer is curative as well as palliative. Curative goes for the children where there is scope for improvement. There is scope that that the child will be able to survive cancer. And then there is palliative, which uses chemotherapy, where we already know that this is a terminal case and the child will not survive. Similarly, we have the treatment plans in homeopathy also. We know already about the treatment plans of cancer, the treatment plans in homeopathy also. So curative treatment in children, that includes chemotherapy, surgery, and radiotherapy. And when we talk about palliation, they only use chemotherapy. Now, something that I would like to tell you here is that when an oncologist considers curative treatment for cancer in children, the WHO has given us the essential medicines for children. So these are those medicines which will cause minimal side effects, which will cause minimal late effects also, because we know that the child has a long life to live. So these are the medicines that are generally used. When I talk about negligence on our part, the first negligence that we often have is a little obscurantism that surrounds childhood cancer, that surrounds this deadly disease. And of course, a little ignorance on our part, because we really do not know about these medicines. We do not know about these drugs. So how can we expect that we will be able to catch the side effects, the symptoms of these drugs later on when the child comes to us as a cancer survivor? Okay, the conventional protocol that an oncologist would follow is the typical TNM staging that we've already learned in our undergraduate study. So the TNM staging classifies cancer according to its spread. So an oncologist would go for surgery in localized cancers where the cancer is confined to a certain body part which can be removed surgically. They go for chemotherapy when the cancer has spread to multiple areas of the body and they need to give you medication through blood, through IV, or through oral for chemotherapy. And they also go for radiation. Radiation utilizes some energy waves to burn the part. But what happens here is, along with the cancer cells, they end up burning the surrounding area as well. So this is a little about the gist of cancer treatment in children. Now, if you've seen the topic, we will also talk about late effects of steroids. It's important to understand the role of steroids in cancer, especially in childhood cancer, because I think not many of us know how steroids help in childhood cancer. So apart from palliation, steroids are given prior to chemotherapy. Now, steroids work by multiple ways, through multiple mechanisms. So, describing how steroids work on all this is a tedious task for in this webinar. But let's leave that topic for some other webinar. But yes, the steroids are given to children to control certain side effects of chemotherapy. Mostly, we see that corticosteroids are used, followed by glucocorticosteroids, and one of the most important, the most commonly used steroids is dexamethasone. We'll come to the effects of dexamethasone lately. Okay, when a cancer survivor comes to us, the role of a homeopath is in the late effects of all these therapies, of the adjuvant therapies that have been given. The role of homeopath also lies in providing supportive care during an ongoing allopathic treatment. So, the situation can be the person is already on, the child is still on follow-up treatment with the allopath, with the oncologist, and they've come to you for supportive care. For example, the child has been vomiting too much, and maybe, say, an antiemetic, say Ondem, is not working with whatever chemotherapeutic agent has been given. So in that case, the parents bring the child to you and they tell you that, yes, we would like symptomatic treatment on your part so that you can control the vomiting and everything. Then we have palliative care, again, terminal case. The oncologist has told your patient that this child will not survive despite treatment, and then the patient comes to you for the relief of symptoms, not cure. Then again, we come to nutritional deficits. Nutritional deficits are certainly an area where homeopathy works better than allopathy. This child could be nutritionally not so sound, and you might need to give him Celicia or something to enhance the assimilation process. And finally, the behavioral problems, so like anxiety and depression, and the child is reading a lot on Google about cancer, and the child is fearful that he might land in another cancer, and this cancer might not get cured and he might die. So all those sorts of symptoms, you have your role to play. The thing to understand here is that the long-term side effects of all these agents that are being given by the oncologist become our presenting problems. But the talent is to identify that, yes, this is one of the side effects, one of the long-term effects of what your patient has been prescribed some 5 years back, some 3 years back, and differentiating from a normal complaint, normal vomiting. So identifying that, okay, this patient has an acute abdominal pain, and that is coming from, say, some chemotherapeutic agent, and then differentiating it from a normal abdominal pain. So your talent actually lies there. Now, one negligence that we often do, we've taken the case, we do consider that cancer is lying in the anamnesis part. We've taken down the presenting complaint, we've taken down the HOPC, the history of presenting complaint, and as a doctor, we know that, okay, 5 years back, this child did have cancer. So we do consider cancer in the anamnesis part. But do we take the presenting complaint as an effect of cancer treatment? How many of us know that, even 10 years after cancer treatment has been stopped, has ceased, you can get an effect of cancer treatment? So that's the first negligence. And this brings us to the question that, should we consider the miasmatic aspect of cancer when we are dealing with a cancer survivor? So Dr. Hahnemann said that cancer is essentially SORA. And then Dr. Roberts, if you have read The Principles of Art and Cure, he says that the precancerous conditions are SORA. Then cancer takes the form of a growth, which could be psychosyphilis. And then it might take the form of ulcerations, which could be syphilis. It might develop secondary infection. It might develop hemorrhage, where you take the tubercular miasm. But going back to this negligence that I've cited here, is that we take down the history and we know that cancer lies in the anamnesis part of it. But the presenting complaint is no more cancer, actually. It is coming from the side effects of the long-term effects of the treatment that has been given. Then do you consider the miasm? So obviously, I think the answer should be no. Okay, so the first question that we should be asking ourselves to avoid this kind of negligence in practice is that what are we doing? What are we seeking here? When a patient has come to us after surviving cancer, are we looking at cure or we are seeking palliation? So that's the first question that you need to ask, because if you are curing, what are you curing? Because your presenting complaint is not the original malady, not the original complaint that the patient had before he was drugged. So are you really seeking cure, or you're just palliating because your patient's vitality has terribly gone down? You cannot assess the particular symptoms of the patient. You will only assess you will be able to assess the disease symptoms somewhat, and the symptoms that the drug has created. So you finally assess the totality. You consider patient's feelings, remedy, and potency, and whatever needs to be done. And you give additional management to this child. Now, something that is important here is that, again, if we do not, if we are not able to recognize that, this cancer, this patient, the symptoms that this patient is presenting with is due to the cancer treatment, how will you give the additional management? You will not be able to provide additional management. What this doctor, the news piece which I cited, what the doctor did was to consider growth as a sebaceous cyst only on the basis of ultrasound. So he was not able to give additional management to this patient, and he only relied on homeopathic treatment. When we talk about curing cancer, because this question has come up, whether we are curing or we are just palliating. So Dr. Kent writes in the lesser writings that in case of cancer, the clear-cut representation of the constitution has not been permitted to evolve. And obviously, he writes that many of our patients come with a history of old school drugging, which is the case that we get in cancer survivors. There is a lot of drugging with chemotherapeutic agents, and every childhood morbid condition has been suppressed, which is true with such strong medicines. Obviously, everything has been suppressed, and the whole picture of the case has been changed. Then can we really cure this patient? Because we are not getting the original symptoms, we are not getting the original picture. So we have to go with palliation only. Now, Dr. Kent also writes that to be able to perceive a remedy from the signs and symptoms in the present or in the history is one item of cure. But another and quite different item is the vital reaction of the patient. So a cancer survivor who has just come out of the trauma of so many chemotherapeutic agents, so many steroids, and so much of radiation and everything, do you really think that he has the vital reaction to react to your medicines, to the similimum? So the answer is obviously no. And then Dr. Kent also writes that to find a remedy that will resolve the lost vital reaction is thus far impossible. So according to him, he has given a chapter, a separate topic on why cancer is incurable. But again, we will not go into the discussion of why cancer can be cured or cannot be cured, because here we are dealing only with cancer survivors. So the aphorism that we should be considering when we are talking about cancer survivors is aphorism 92, where Dr. Hahnemann says that in all these cases, these are like one-sided cases where you're not getting so much of so many symptoms to assess your similimum. So what you do is you take the conjoint picture, you take the symptoms, the whatever symptoms are available of the patient, and you also take the symptoms whatever are available after the remedy, and that's how you prescribe. You will not get a clear picture, of course, but then you can really assess a little bit of, you can get an idea of what the picture would be. So that's how you prescribe here. And then the proof, obviously, why I am saying that we would rather palliate these cases and not seek cure is because partial similimums, these are only partial similimums that we are getting because we do not have the original malady in front of us. So partial similimums only palliate, they never cure. That's a rule. We know that already. Now, another negligence that we commit when we are dealing with cancer survivors is that we do not know what is to come next. आपके पास एक patient आता है, you take the presenting complaints, you take the history of the presenting complaints, you know that there is cancer behind this, whatever symptoms are coming up in the history of this patient. But a good practice, a good medical practice is always to expect that what this patient will go through in the next 1 to 10 years. So one negligence that we are committing here is that we do not know that this particular presenting complaint is coming from the cancer treatment, from whatever treatment has been given, and what else can I expect. So for example, again, a patient comes to you, say, with palpitation, with a lot of palpitation that has developed a week back, but the cancer was, say, 5 years back, and the treatment provided for cancer lasted for 3 years. So say maybe 2 years back the cancer treatment ended, and now your patient has developed palpitation. Not even in the wildest of your dreams you will imagine that this palpitation can go into cardiac failure. Why? Because cardiac failure is a side effect of one of the chemotherapeutic agents like busulfan. So if you're not expecting what is going to come next in the next 1 to 10 years, how do you think you will not be negligent? Talking about late effects, the example that I've given, just that the cancer was in 2005, the patient came to you in 2010, telling you that I've just developed palpitation and it has developed a week back. So what classifies as a late effect? How can you recognize that this is a late effect of cancer treatment? So the WHO says that late effects are conditions that continue to develop 5 or more years after a cancer diagnosis is made. So it really does not matter when this complaint came up. What matters is that suppose, for example, your patient was diagnosed with cancer, say in 2000, and 5 years after that, 2005, he develops palpitation, he develops acute abdomen. So obviously that should be classified as a late effect in case that is coming from any of the chemotherapeutic agents that have been provided, that have been given to the patient. Now here we have the medicines. If you remember, I have already talked about the essential medicines list that the WHO has come out with. So we have busulfan, we have other several chemotherapeutic agents and the side effects of these agents. So for example, I'd like to take this example that a patient comes to you with anuria and or with oliguria, and you prescribe some remedy for oliguria, for say you prescribe Heparsalve, you prescribe whatever remedy, taking in consideration that this should be trimiasmatic, this should include cancer in the miasm, but you forget that this oliguria right now can be a symptom of damage to the kidney. So you're not expecting that this patient will go into will land into renal failure soon. So that certainly amounts to negligence on your part. So we have all these remedies listed, and all these side effects enlisted for us, and we must consider that we must consider that these side effects of these remedies can affect our patient later on also. Even after 5 years they've been stopped, after 10 years that they've been stopped. Similar is the case with radiation. What happens in radiation is that the part is being burned, the cancer cells are being targeted, and apart from cancer cells, we are also burning the surrounding cells, the healthy cells. And one of the effects of radiation that we do not imagine is that long term it leads to hair loss. Hair loss is also evident right at that moment when radiation is going on. And bone development is hampered. So your patient might land into osteoporosis, your patient might land into renal failure after radiation has been provided. Of course, it matters that which body part the radiation has been given to. So these are two alopecia cases. This one, the first picture shows you the case of an ongoing radiation treatment. And finally, this child, he is a cancer survivor where he's lost all his hair. So that's that kind of patients you get. Then radiation also leads to burns of the skin, and we know we use several remedies. We have radium brome and all to tackle this problem. Then we have diarrhea and nausea and vomiting and a lot of fatigue. So if your child is coming with these symptoms, even after 5 years, you should consider that this can be an effect of radiation therapy and not of cancer per se. Then we come to steroids, because steroids are administered to every child before beginning with chemotherapy. So obviously, even after chemotherapy is done, we see long-term effects of steroids in children. And these mostly include muscle wasting in children, in debility, in weakness, osteoporosis, and all these things we see in as late effects of steroids in children. So another negligence that we do is, suppose a child comes to you with sweating, with a lot of sweating that happens only at night. He wets the pillow, and you prescribe symptomatic, you prescribe calcarea carb. Did you think that this patient was on steroids a few years back, and this could be diabetes mellitus also? So what happens when we withdraw steroids? Diabetes mellitus is already there. This is called juvenile diabetes mellitus. It is also called steroid-induced diabetes mellitus because it is being induced by steroids. So what happens? Periods of hypoglycemia. The child goes into sudden hyperglycemia and then sudden hypoglycemia. And what are the symptoms of hypoglycemia that we see is sweating. So rather than prescribing calcarea carb, the negligence on our part is not checking the blood sugar levels. Now, when we talk about steroids, we must also talk about the specific effects of prednisolone and dexamethasone, methotrexate to some extent. Dexamethasone is the most common steroid that is prescribed to children. And you can see here how the bone has lost its minerals. So your patient comes up with say bone pains after playing. The child's parents say that the child gets tired and he develops pain in the legs. So the first thing is to ascertain where exactly the patient has pain. The patient has pain in the muscles or in the bones. Mostly it is shin bone when it is coming from the bone. And a general practice is to go for serum calcium levels, but the serum calcium levels come out to be normal, so you take it to be functional, because cancer बहुत पहले का हो गया and cancer का treatment बहुत पहले बंद हो गया. You do not again, in the wildest of your dreams, you cannot imagine कि this patient, this symptom is coming not from cancer, not from cancer miasm, but from the treatment of cancer as an effect of cancer. treatment as an effect of steroids. So you will never imagine that you can go for bone mineral density. And why serum calcium is coming high is because the bone mineral density is low. So something that we need to do here is remove the maintaining cause. We need not to prescribe medicines on the symptom, on the functional symptom, rather go for biochemics to supplant the patient with calcium, the calcium that has been lost. Then we have certain tests that should be conducted, that again homeopaths generally do not conduct these tests to check for the effects of steroids. So we should check for blood sugar, we should check for urea and electrolytes, we should check for LFT and KFT. A lot of these things will tell us whether the symptoms, the presenting complaints are coming from the cancer treatment or from or they have some other origin. And last, we come to a nutritional deficit. So what happens here is there have been multiple studies, there have been multiple researches that say that every cancer survivor deals with malnutrition. Why a child develops malnutrition? Because firstly, if a child has cancer, it is the natural disease process also, that there is loss of appetite, there is a lot of diarrhea or whatever part is affected. According to that, we have symptoms. And then when he is put on chemotherapy, when he is put on radiation, so he also develops a desire, an aversion to food. The patient cannot have food. Sometimes he cannot swallow the food. Sometimes he develops such bad dysphagia that sometimes he develops mouth sores, mouth ulcers, so he's unable to eat. That is also a cause of malnutrition in these children. So a parent will never come and tell you that my child is suffering from malnutrition because of the cancer treatment. It is for you to diagnose that. So we have a number of methods how to assess nutritional status in a child. We have anthropometry, we have biochemical evaluation, we have clinical examination. So we should be adept at understanding that this malnutrition is there, and it should be definitely corrected with biochemic remedies. Now we also have a separate course on biochemic remedies running live on www.thehomeopathicacademy.com, and you can certainly enroll in that course to understand how to use biochemic remedies with homeopathic dilutions. And coming to the additional management of these patients, obviously a balanced diet is important. For cancer survivors, nutritional interventions are certainly required, because there's hardly any child who will not suffer malnutrition when he has just survived cancer. Obviously, why to address nutritional deficit? Firstly, because causa occasionalis, everything that has a maintaining cause, you have to remove the maintaining cause. For a person, for a child who is malnourished, you cannot administer a Silesia and think that, okay, this person will be fine. So again, we come to the same thing, that not every management is therapeutics. Therapeutics is just a part of management, and management encompasses everything, which includes therapeutics. Then we come to behavioral problems, and this child will definitely have anxiety, depression, and it is for the homeopath to be able to assess that this isolation, this grief, all these personality changes, they are coming from the fear of cancer that has set in, the fear of this kind of treatment that has set in. So it's again negligence when we neglect all these behavioral problems in the child. Because a parent is so focused on the cancer is so deadly as a disease in itself, that the parent does not tell you that my child has lately stopped playing with other kids, my child is always on Google trying to find his symptoms. They do not attach so much importance to that. So it is important that the doctor, the concerned doctor investigates the case thoroughly, talks to the child, and finds out what is the mental setup of the child, what is the child going through. So all these symptoms should also be included when we are prescribing for cancer survivors. And again, we have this course called Psychiatry, which is running live, streaming live on the www.thehomeopathicacademy.com. So you can enroll into this course, and you will understand how to manage all these symptoms, all the symptoms of anxiety, depression, personality changes, sexuality problems in children, as well as in adults, of course. And you will understand how we address psychological challenges in children. You will come to know about psychotherapy, then how do we use behavior therapy, and when to advise such therapies, when to restrict, when to confine yourself to your system of therapeutics, and order additional therapies, that when to understand that your patient is now going beyond your limit, and you need a psychologist, a trained psychotherapist, to talk to your patient and help this patient. So all this has been covered in the course of psychiatry. A third negligence that we often commit is not keeping the medical legal angle in mind. When a patient is coming to us from another therapy, from oncology, from a primary oncologist, we must respect the term called patient ownership. There can be two scenarios: the patient is still on treatment, and or the patient is on follow-up treatment. So in both cases, it is important to respect the domains of homeopathy and allopathy, and to keep in touch with the primary oncologist, because obviously time to time in the course of treatment you will need to talk to them regarding the unity of medicine. So we need to tweak the homeopathic case taking, the performa that we generally use to take the case of our patients. In case it is of childhood cancer, we need to know the date of cancer diagnosis, the date when the diagnosis was made. We need to ask the parent if the child has had any recurrence. We need to ask the type of cancer. We need to ask what was the stage of the cancer when it was diagnosed. We also need to keep note of the hospital where this child had been admitted, and whatever treatment, wherever was it provided. That's from a medical legal point of view. And then we also need to keep in touch with the primary oncologist. So the negligence that this doctor had done was not keeping track that that was a false diagnosis, of course, but he could have asked better questions to elicit if there has been any cancer in the family, and should have been open-minded a bit to understand that this could be cancer also. Then we should also take note of the dates wherever the treatment has been given and the treatment ended, the drug types and dosages that chemotherapy was given, because that will help you to assess if this presenting problem that you have right now is coming from cancer treatment, or it is just some functional problem. And then we should know the affected body sites, and because radiation focuses on certain body sites where the cancer has been present, and for that you must know what was the primary body site that was affected, and how metastasis happened, and how the case progressed. And then we should also ask the patient specially about any other treatments that were given to the patient. So these can be bone marrow transplantation, this can be stem cell transplantation, this can even be simple blood transfusion, because that will help you to understand if आगे कुछ भी आ सकता है, कोई भी presenting complaint आ सकता है. उस तरह से to plan your treatment, you will need all these details in case of cancer survivor. Then we should also take note of treatment related problems, because whenever an oncologist takes a case, they often enlist the treatment related problems, the problems that can come up in due course, with chemotherapy, if they're giving chemotherapy, after surgery, if they're planning for surgery, and after radiation. So they take note of that. So you should also keep that note that these things can come up according to the primary oncologist. Obviously this tells you about the possible long term effects, I've already told you. And the recommendations of the primary oncologists are also important, because they also help you a lot to manage your cases. Okay, the fourth negligence that we often commit is not knowing when to refer the patient. So this again, we must pay heed and ask ourselves what indicates a relapse of cancer in children. So, for example, your patient has come up with fever, and that has lasted for the last 7 days, and there's a lot of sweating. So you should really consider that this patient can be going into a relapse of cancer. There is persistent headache at night, and there are bone pains, there are personality changes. So all this tells you that this patient is going into a relapse of cancer. Now, learners, let us take a break. And on the right hand side of your screens, you have a poll running. And please answer those questions, and we shall continue. Okay. So now that we are talking about this negligence, that we do not know when the cancer is going into a relapse, we should really take some tests. We should really order some investigations that keep telling us that this child is not going into relapse. And one of the best investigations for this is lactate dehydrogenase. This is an enzyme that looks for signs of damage to the body tissues. So when a cancer survivor is coming to you, you must get it done periodically to check if any of the muscles, brain, kidneys, and pancreas, any of these organs are falling short of their optimal performance. So lactate dehydrogenase is one enzyme that will tell you exactly what is going on in the body and whether the patient is going back into cancer or not. So that's how you evade from this relapse of cancer. And I think that's enough. We are already running short of time. So I think let's wind up here. We have a few more poll questions. If you look at the right hand side of your screens, we have another 2 more questions for all of you. You can open the right hand side column and answer your questions. Thank you so much. So since we are already short of time, I think I will take one major question that has been asked. Curative treatment cannot be with side effects, but do we get cure as claimed in the slide? I am not getting this question. I told you that there are 2 treatment plans, curative and palliative. Why curative cannot be with side effects? Because with oncology, if you've studied any pediatric oncology textbook, they tell you that at times they go for curative treatment, but they know that their medicines do have side effects. So obviously side effects will come up even when they've cured the case. So if you're taking it from the homeopathy angle, obviously that is why I said that we are actually not curing the patient, we are actually palliating the case. And if you're talking from the oncology angle, so yes, of course, if you've seen the slide properly, when I talked about late effects, they've also written, this is from WHO, and this has been taken from cancer oncology, the oncology, pediatric oncology textbook. They write that despite treatment, despite curative treatment, the patient may not survive. So if you look at it from the oncology angle, and you will realize that despite treatment, there are cases where the patient will not survive, and they know it already, because say for example, the vitality of the patient is too much down, there has been a lot of damage. So obviously this patient will not survive despite your efforts, despite treatment. I'll take you back to the slide where I was talking about the late effects. So we have all these remedies where I told you that these are the remedies that are being used by chemotherapy, by oncologists for chemotherapy, and all these have their own side effects. And if you really look at them carefully, you will realize that neurotoxicity and autotoxicity, these are also the kind of symptoms that are coming up. See, in the last 30 years, treatments and supportive care have improved. As a result, more than 80% of children treated for cancer live 5 years or more after treatment. So that means eventually they may even die. So, but there are risk factors. They are at risk for long-term side effects called late effects. And these are related to their prior treatments. So obviously an oncologist also takes into account that I am going for curative treatment, but despite this treatment, this child may only live for 5 years, may only live for 10 years. And they also write down, that is why I told you that you should take note of whatever the oncologist has written as probable long-term effects of my treatment. So if I am an oncologist and I have decided that okay, this child can live, I still have hope, so I will go for chemotherapy, but I will also write down that these are the long-term effects. So this child may survive, may not survive. If you've seen, there are some chemotherapeutic agents where abnormal heart failure is a potential long-term effect of busulfan. So if my child, if my patient is still is giving me hope that yes, this child can live, I will obviously try this medicine, but I know that it has side effects. So I will also write down for the next doctor, whoever sees the patient, that yes, I gave this despite treatment, this child might go into heart failure. So obviously curative is with side effects, comes with side effects in allopathy, in oncology. And I guess all of you have answered the question. And so let's wind up here. We're already running short of time. Thank you so much.